Hello and welcome to the Friendly Pharmacy 5 Book Club, Session 4. Today we are calling this session Gut Health Jeopardy! And I have the authors of Gut Logic, which is the book that we're featuring, and we're going through this book kind of chapter by chapter, not really chronologically, but every session that we are going through in these sessions is covered in the book as well. And so Gut Logic is a book that I was also able to contribute, though I have no financial interest in this. And I think it's just a topic that there's so much interest in this. But again, as I've said, if you've been in the sessions before, there's also so much misinformation and even confusion on the topic of gut health. And so I have Dragana Skokovic-Sunjic, who also contributed to the book, as well as the author of the book, Graham Mackenzie, with us. Now, Graham and Dragana are both pharmacists, as am I, and they're quite accomplished, and I will tell you about them a little bit more as we go through this session. But first of all, this is a live session, and so we would really like you to be able to engage in the comments. Let us know where you're from. If you've been in previous sessions, let us know maybe what your biggest takeaway was. Some of you were probably in last week's incredible session with Dr. Demianos. He spoke about irritable bowel syndrome, and it was quite a comprehensive presentation that he gave. So if you've been in the sessions before, let us know what is your biggest takeaway. And then also, if you have questions as we go throughout today's session, please feel free to leave those in the comments because we are going through the comments to take your questions today. So Dragana and Graham, thank you so much for joining me again today in session 4 of our book club. How are you both doing?
Doing
I'm
good,
great.
thanks.
Thank you. And thanks for inviting us to do this kind of a fun session, probiotic or gut health jeopardy.
Yeah.
So I'm ready. Are you ready, Graham?
I'm ready. It's always nice to meet up with you because in real life we have never actually met, all three of us, face to face. I know you two have, but someday we will.
Absolutely.
Yeah, someday we will. And Graham was speaking. You did a speaking engagement this weekend. Dragana, you were speaking last weekend as well. Can you tell us a little bit about what you two have been up to?
So I just did a
Uh,
talk in Halifax, Dal, and they had their continuing medical education with 200 plus prescribers. So my talk was on adverse medical events with drugs. And it sounds like a dry topic, but it was really kind of interesting, and I was glad to have the opportunity to go up there.
And what about you, Dragana? What have you been up to?
so it's always something happening. Last weekend, there was a huge pharmacist conference in Toronto called Pharmacy U, one of the biggest events for pharmacists in Canada. And I was the speaker. Topic this year was women's health, perimenopause and menopause. Previously, I was at that conference as a speaker talking about probiotics and all different kinds of things about microbiome. This time it was a slightly different topic, again, very engaging, and pharmacists are so important, so easily accessible, and so knowledgeable in so many different topics and always eager to learn more. So make sure to know your pharmacist and connect and use it as a source of information.
Absolutely. And you both are just such a gift to the pharmacy profession, but I won't start bragging and complimenting you too
As are
much.
you.
We need to get further into the session here. Thank you, Graham. That's very nice. So again, if you're just joining us, please let us know where you're from. If you've been in the previous live sessions on gut health with us, let us know what your biggest takeaway has been. Some of you who are joining us today have won books in the previous sessions. And so just to let you know, we will be giving away a free copy of Gut Logic at the end of this session as well. And so if you comment, the way you get entered into this draw is if you comment or you leave a question on any of the platforms that we're streaming from. So we're streaming from Twitter, also known as X, LinkedIn. We are also on YouTube. So any of those platforms, if you comment, even just let us know where you're from or make some kind of a comment or question, because we will be answering your questions. Like I said earlier, you will be automatically entered into the draw, and we'll be sending you a free copy of Gut Logic by Graham Mackenzie. So I also wanted to mention, if you do want the Q&A transcripts from these sessions, you can go to friendlypharmacy5.com. And if you sign up for our newsletter there, the newsletter is basically where I share insights on different health trends and things that I'm kind of following that I can't really necessarily make a video out of. And so it takes a lot of production time to make these videos and to do certain interviews. So there's a lot more that I like to share in the newsletter. And often you do get insights as to what might be up or little clips and things that you won't find on the channel, right? So, and in addition to that, you can get the Q&A transcripts, and those have just been so insightful. I know Dr. Damiano's Q&A last week was just jam-packed with insights on things like leaky gut, gluten sensitivity. It was just quite incredible. So you can always watch the replay while they're up, or you can get the Q&A transcripts. I know some people prefer to just to read. So these sessions are also brought to you by the Friendly Pharmacy 5 podcast. So we do not have any industry sponsors or anything like that for these sessions, but we do have a podcast where we have our expert interviews and interviews with experts. And so if you are interested, you can always listen to the Friendly Pharmacy 5 podcast, and some of those are also on video as well, even on Spotify. So without further ado, I would like to get into today's session, where we will be debunking some of the most common myths and misconceptions about gut health. And so I told you before that I was going to say a little bit more about our expert guests here. Graham Mackenzie is a pharmacist from Baddeck, Nova Scotia. He is a pharmacy owner for over 20 years. He just sold his pharmacy, but he is the author of not just Gut Logic, but also Healthy Logic, which I have right here. And this book is actually a great reference. It goes over a lot of different questions, I think, that Graham and all of us get as pharmacists, and what the evidence is for things like omega-3, vitamin D. It's very comprehensive. It's a great reference, though. So that was Graham's first book, and his second book is Gut Logic. And now Graham still works and practices as a community pharmacist, but he also gives talks all over the country, and also he is frequently on the radio. Is that right, Graham?
Yeah, Maritime Noon CBC has been gracious enough to take me on every now and again, and whenever you get a pharmacist there are always lots of questions. It doesn't matter. I'm sure both of you know that when you're in a room with 10 or 200 people, there's always lots of questions, and there's never a shortage of questions on that radio program.
And I think it's very courageous of you. I know we're live today, but to go live on the radio and take questions like that, because you literally, I don't know if you have themes for those interviews, but you literally could get anything on the radio, right?
Yeah, we do have themes, although virtually every single program kind of just evolves into just questions. You know, that's just the way it goes. People have their own questions. And I get that statement that you just gave. You know, how can you do that? It's live. It could be much, a lot of weird questions. But honestly, it is no different than being on the phone at the drugstore. It is the exact same experience. And in fact, when I go there, I'm wearing the exact same smock and name tag that I wear at work, just to put myself in that frame of mind. And it's a lot of fun to do.
Mm-hmm. Except your impact is so much bigger, and I'm sure you're just helping
Mm,
that many more people, right? So
hopefully, yeah.
yeah, absolutely. And then Dragana Skokovic-Sunjic is also with us. And for those of you who don't know, she is a practicing pharmacist, but she's also a certified menopause practitioner. Is that the right term, Dragana? Because I know it changed recently.
The Menopause Society certified practitioner. So yeah, menopause practitioner is for short. Yes.
Yes, and she is the author of the Clinical Guide to Probiotics. And so the Clinical Guide to Probiotics, you can find it at aeprobio.com. It is a free resource. We've mentioned it many times in these sessions. And what she's basically done is compiled all of the evidence for probiotics according to the type of evidence that's available, and also categorize it according to the products that are available on the market, right? And so it's a great guide for healthcare professionals, but also for anyone in the public to be able to access and choose the probiotic that best suits the condition that someone is trying to treat. And we're probably going to talk more about that in the Q&A today. But also, Dragana is going to be with us in a few weeks because she is going to talk specifically about probiotics and women's health. And so watch for that session coming up, right, Dragana?
Absolutely, absolutely. And as you mentioned, the clinical guide to probiotic products in the US and in Canada is a tool that has been designed 16 years ago with the aim to educate healthcare professionals, pharmacists, physicians, dietitians, to help them navigate when they're recommending probiotics to their patients. And it's been growing in popularity. So even patients or consumers are now accessing it and taking this as a question to their provider, saying, is this particular product or strain good idea for me, because looks that there is evidence for this particular indication that is listed there. So that's a kind of a scientific approach, but making it more digestible, easily to understand. So you don't have to read the 15 pages of each study. We've done it for you. So there's a group of experts that does review the content of these clinical guides annually. And we look at the new evidence, new products, or maybe old products that have changed, and assess if this is still appropriate to be listed in the guide.
Yeah, and that's really important that it is reviewed annually because this is an industry that is just changing so quickly, right? And there's always new probiotics on the market, right? And the evidence doesn't necessarily always match what that probiotic company is claiming, maybe even on the label of their product, right?
That is correct, yes.
Yeah, so I'm not going to delay anymore, but again, if you have questions, please feel free to leave them in the comments. We will be getting to your questions as we go through some of the most common myths or facts about probiotics. And so since we are pharmacists, I thought that we would start with a question about medication. But this is a type of medication that a lot of us, most people have probably had some kind of experience with. And so if we can go to our slides, what I want to go through is the first question that I have for our experts. So, Graham and Dragana, let's discuss this. Is this a myth or a fact? Probiotics can be helpful when on a course of antibiotics. So, as a pharmacist, for quite a while, we have recommended probiotics while a person is on a course of antibiotics. Then that kind of evolved to say, well, maybe you shouldn't take it at the same time as the antibiotic because that doesn't really make sense, right? And then there's also been a little bit of controversy about this, about whether is it really beneficial? Does it really increase diversity of the microbiome? It really doesn't, I don't think. But I would like to know, what are your thoughts on this? Who wants to go first?
Can I press the buzzer first? Or
Yeah.
Graham, do you want to go first?
Go ahead.
So this is a great question. And, when I was 20 years ago practicing as a pharmacist, not really knowing much about probiotic strains and specificity of probiotics, I would tell my patients to, when they're taking antibiotics, to eat some yogurt because I did not know better. But now, with so much evidence behind this is what we know. First is that when we take antibiotics, we kill bad bacteria. That's the aim of antibiotics, to clear the infection. But we also kill lots of good bacteria in the gut, in vagina, in our body. So we then maybe suffer consequences of the problems because we're killing good guys as well. We might get diarrhea that is associated with antibiotics, maybe even wake up this kind of a bad bacteria called C. difficile, cause more complications, or maybe get vaginal yeast infection and those kind of opportunistic infections, because we are killing the good bacteria as well as bad. So then we were doing lots of studies, lots of research, meta-analysis studies using specific probiotic strains or products along with antibiotics to see if there is a potential prevention of these complications. And we found lots of good evidence. Some of the Canadian companies have been leaders in this research and with really great evidence for prevention of the antibiotic-associated diarrhea or even C. difficile complications or diarrhea with the use of antibiotics. So this is the facts that we know. They are, so answer to this question is yes, maybe. So not all probiotics will be helpful, but specific ones will be extremely helpful for complications with the antibiotics. You also mentioned something, and Graham can maybe build on that. Lately, we've been hearing something about it was in headlines recently that probiotics can harm you if you take them after antibiotics. That is, I think, misinterpreted statement, because we cannot say probiotics. We can say this specific combination of unknown probiotics that we used in this study was not helping. That would be proper statement. So if we know what we're using, then we know what to expect. So, and we also do not ever expect for the probiotics to colonize the gut or to stay in the gut. They just help and then they disappear.
Yeah, good point. I think that last statement you were making about probiotics is so important. We see a lot of studies that just say probiotics don't help for a given condition, and these are scientific studies that are saying things like this. But really, you need to be so specific, not just on the exact strain or strains, but the amount that you're giving. And the comparison I give is, if you said you had high blood pressure, and I said, you know what, I'm going to send you into my pharmacy. You can just walk in there. I have lots of things that are great for blood pressure. And you just went in and grabbed a bottle off the shelf and walked out and took it. You could say, well, that didn't help my blood pressure. Well, that's because you took something for gout instead of blood pressure. So you have to be really specific on the exact strain that you're taking and the amount. And another thing too, whenever we're educating, and I go through this all the time with educating in professional groups, it's so important to give the brand name of, and that's not something that we typically do when we're educating on any medical condition at all. But it's just so much easier. Like in your site, the aeprobio.com, it tells you exactly the brand name. It tells you the strains that are in it too, but it tells you the brand that you're looking for, because the pharmacist and the patient will be looking forever for that. And to get back to the diarrhea, antibiotic-associated diarrhea, we spoke about this at the talk at Dal I was in yesterday. And one thing I put out there was that it's always good to have a Cochrane review. Cochrane review, these people are difficult to bring on board for things, things that you think might be a given or a slam dunk. They may come up with, there's not enough evidence to show it. And certainly for children with antibiotic-associated diarrhea, they had a meta-analysis of 33 studies, 6,300 children, and they found the number needed to treat was 9 with that. So, which in medicine, a number needed to treat of less than 50 is pretty good. So a number needed to treat of 9 in preventing diarrhea and treatments from 5 days to 12 weeks is pretty good. And the C. difficile, there was also a Cochrane review there. 39 trials, over 10,000 patients, and there's a 60% reduction in the risk of developing C. difficile. C. difficile is not something you want to fool around with when you're on an antibiotic, because once you get it, the chances of you getting it again on an antibiotic are pretty good. And Dragana's site points out with the level 1 evidence with the Canadian red signia next to it that is Health Canada approved on the probiotics specifically that work for that. So I use that site all the time. I use it almost every day at work, and it's great when you have a physician. They're just so surprised that the evidence is there when you show them that site. And for diarrhea, it's one of the best uses of probiotics is preventing antibiotic-associated diarrhea.
Yeah, so we do have that tool in our toolbox, and I would agree with you both that there's certainly the evidence for it. And if you want to see the evidence for it, you can check out AE ProBio for the recommendations as well, because we're not going to specifically recommend. We can't specifically recommend anything for you in particular on this session, right? But if you do have questions, again, you can go to aeprobio.com, or you can ask your pharmacist, because they also should be aware of this resource, right? Especially if you're on like one of the antibiotics, like broad spectrum antibiotics, right? There's a few that are seem to be a bit worse than others. I don't know if you guys would agree with this, but I'm thinking along the lines of like, a clindamycin or moxiclav, ciprofloxacin. I mean, you definitely want to be trying to compensate a bit for what's going to be happening in your gut, right? Even though we do want the beneficial effect of the antibiotic, which is to clear the infection, right? So
yeah, and at Dal, we had, go ahead, Dragana.
Sorry, I just wanted to add that, there is also emergence of the bad bacteria learning how to resist the effect of antibiotics. So
Yes.
then we have that big issue, and then is antibiotic stewardship, like using antibiotics very specifically and kind of scrupulously, so we do not teach bad guys how to get resistant and fool the antibiotics. So then we end up with the pathogens that cannot really be killed with anything. So that's kind of a whole topic for another live. So I think we have answered this question. We can probably go to the next one. Graham, I interrupted you actually, so sorry about that.
No, I was just going to throw out that Dr. Bradley Johnson at Dow in 2018, he grabbed a bunch of different probiotics, and although we do have ones that specifically are proven for it, he seemed to find that even giving a probiotic to somebody in the hospital was helping prevent antibiotic-associated C. difficile. So we definitely know it's a home run with probiotics.
Yeah. And Dr. Bradley Johnson was actually on our expert review board for a couple of years before he moved to Texas. So yes.
Nice.
Excellent. So I think that clears up that first one. I just want to mention Konica Shannon is here from Alabama. Welcome, Konica. As well, we have someone tuning in from Texas who's asking about yogurt as a probiotic. Which one is best? So we might get to that one, I think, a little bit later. The difference between a prebiotic and probiotic we did cover in session 2. Actually, I went very thoroughly through that. So we can, Julian's our producer. He's kind of in the background here, making sure this runs smoothly. But Julian, can we just tag that one maybe for a little bit later, and we'll address that in the Q&A. Let's go on to myth or fact number 2 here. Before we get to that, I want to just show you how fast this industry is growing. And so this market research here is showing where we're at in 2024. So the probiotic market is estimated at about $75.6 billion. And the compounded annual growth rate, it's supposed to grow by about 8.22%. Projected to be $141.52 billion in 2231. So this is a huge market, and it is growing quickly. But unfortunately, the regulations, it's very easy, as Dragana has talked about on this channel, it's very easy to launch a probiotic, and every country has different regulations, of course. But these products are not necessarily launched, I guess, with the best evidence. Would you so let me just get to the myth or fact, and then Dragana, maybe you want to talk to this. So myth or fact number 2, most probiotics on the market have proven health benefits. I am really interested to hear what you guys have to say about this one.
So for answer to your question is simple no. And for a bacteria to be a probiotic and be marketed as probiotic, there are certain set of criteria that has to satisfy, has to be defined, has to be resistant to antibiotics, has to, we have to know what it is, and has to be safe. But the benefits, nobody needs to really show specific benefits to be on the market. And what the problem is, sometimes there is a strain of bacteria that is so beneficial, and we know it works, and we know exactly in what dose it works. And then we have lots of research. But then there's another company that takes that particular strain and adds 5 more, just so, they're slightly different. That new product, this new combination might not work as well as the single one because it's just too many people. For example, in this live, if you had 15 people talking at the same time, nobody would understand what's going on. So similar things happen with the probiotics. And we also know that if something is safe and we don't really have evidence what it does, it can be sold. And if you put a nice colorful label, put some kind of a fancy statements on it, fancy name, maybe hire somebody like influencer, an actor, or some good looking lady, girls, saying, oh, this is great, I feel so great with it, people will be buying it. And when we look at what we have just on a North American market, when you walk in just typical grocery store, supermarket, or pharmacy, in most of the time, 1% of these products will be products listed in a clinical guide. That means products that have proven benefit. The rest will be not harmful, but most of the time not helpful. So that's kind of my take on that question. Graham, what do you say?
Yeah, so I think you hit it right on the head there. The influence that some people have to sell a product. Some people just have to be seen in public eating a certain type of yogurt, and they would claim that it helps for whatever they want. And unfortunately, that's what we live in right now. We live in an age that people try to find a quick fix for something, which is why I think the supplement industry and that part of the pharmacy has always been, I think, legitimately a target for people that will just say, why are you selling this? Like, what is the proof that you're selling these supplements for? Are they harming more people than they're helping? And it's a legitimate argument, and unfortunately, probiotics get pulled into that as well. I think the supplement industry, the way that it runs, and I try to separate that in the book. That I know how you feel about supplements. I know there's a lot of people making a lot of money out there, making a lot of claims about a lot of supplements, but a lot of it, unfortunately, just is not true. Even and people will go out there and just kind of buy yogurt thinking that, well, that must have probiotic in it. And specifically, the definition would be that it's a live microorganism that when you give it in an adequate amount will confer a health benefit to the host. So just because it has microbes in it, that does not mean it's probiotic. And I think that definition might be missing in the minds of a lot of people, because you have to get a health benefit from the host. And in order to get that, the only way that we can prove that is through the scientific method, really. And I think, level 1 evidence, which you have on your site, Dragana, where you've got controlled randomized trials, or level 2, where they're well-designed controlled trials without randomization. This is the only way that we can prove that probiotics do what they do. And when you throw one thing in there just to kind of copycat off another one, it automatically becomes a different product, and you have to kind of start all over again, proving yourself.
That is correct. That is correct. I mean, so many examples as well. Sometimes you see, for example, a combination of 2 strains in specific amount being given to patients in a yogurt format. So there's a yogurt, and there's 2 strains added after yogurt is made, and that particular yogurt that was available in Canada, now it's being discontinued, was actually helpful for the type 2 diabetes, and it was listed in a guide. Unfortunately, it's continued, but they also did studies with using the same 2 strains combination in a capsule format to same population, diabetic patients, no benefit, actually worsening of the A1C. So you cannot assume that if it was working in one dosage format, it will work in the other. So unless you have a proof. So those are kind of a nitpicking, and the pharmacists like to look at the evidence and really take evidence apart and be critical, appraise it properly before we recommend something for patients. And this is what the guide is actually reflective of.
Yeah, I've written extensively on the front store of the pharmacy and how little proof there is on a lot of the stuff out there. So to have at least one small little niche that we can kind of prove that this is going to help for whatever condition we're pointing out is such a help.
Yeah, and just
I agree.
what you were saying there, Dragana, did you say that only 1% of the products that are available generally make it into the guide? Well, is that what you said?
That is exactly what I said. Maybe even less when you look at what's available online. But sometimes I go just because I'm curious, and we do our own market research to see what is available, what's listed in Canada, in the US, what's been approved, and try to find and identify how many products I see on the shelf that are actually found in a guide. That's very scarce. Sorry.
It's incredible. We had an interesting comment come in here. We've got people joining us from Vernon, from Ontario. Thank you so much for everyone for joining us. Every time you comment, you're going to be entered into our draw for the copy of Gut Logic. So Mahai Wilson says, thanks for this, tuning in from Vernon, BC. I'm curious about the accuracy of mail-away microbiome tests. So we did address that, I think, in our last session with Dr. Damianos. So if you go into the Q&A portion of that session, I think that was in there. So maybe check there. But also there's an interesting comment here from Kim Reville-Montag when you were talking, Graham, about the incredible amount of supplements out there. And Kim says, true, and Costco makes it very easy for the population. And so we're fine with Costco here, not saying anything bad about Costco, but I mean, just the sheer abundance and quantity that we have available here of vitamins, supplements, and probiotics, right? It just, and we don't know, like, are you really getting the benefit that supplement is providing, or or that the benefit that you were promised based on whatever marketing it was that you saw, right?
Yeah, labeling can be very catchy, and it's unfortunate some people will buy something for their health based on how the bottle looks. It's just the way human nature is, and I've been to trade shows where there are booths set up where people sell drinks that have probiotics in them, and it's funny, you could sell something without lying at all, but you're not really selling something that claims anything. You could say, oh, I feel so much better when I drink it myself, and it has 20 different strains in it, and it's really helps to populate your gut. Well, all true, but outcomes medically is the thing that's missing.
That's correct. And one more thing, when we talk about, stores and Costco, for example, in Costco, they actually do sell some of the products listed in a guide with good evidence, but also Costco and pharmacies and big box stores do have their own private lines or store brands or generics that, we'd call them. So that's one of the interesting things when I do presentations, I talk about that. There's really no generic for probiotics. If there's a strain, it might have different names. It might be available as one product, brand A or brand B or C, but there is no store brand of the strain. That's most of the time. We got used to, aspirin is the brand name, but acetyl salicylic acid is the chemical, and there is a Shoppers Drug Mart, Rexall, Walmart brand. So it's basically the same chemical. But when it comes to probiotics, if the strain is not the same, it's not the same. And I've seen kind of almost like mimicking or being chameleon. There's a brand name product with great evidence. We know it works for IBS, has very specific, distinctive colors on the box. Beside it, it's a store brand with the same colors, but completely different strain combination that have no evidence. But for the consumer, looks like there's a brand name, double the price of the generic or store brand. I'm going to get the store brand, which is not going to work. So,
and I think the very first name, like if people see lactobacillus, they'll think, oh yeah, that was the name I remember that worked for the other thing. And there are just so many different strains out there. You're right. And this is why I use brand names when I'm educating physicians and the public on things. It's just, you really have to point them to that product.
Absolutely. Absolutely.
Great points from both of you. We have some really good questions coming in from the audience. And so I want to be able to get to those. So I'm going to keep us moving here onto our next myth or fact. So the next one, number 3. So there is a lot of interest in the gut-brain axis and the microbiome. And so we wanted to discuss, can probiotics have a beneficial effect on mood and depression? Now, Graham has a whole chapter on this in his book. And so I'm going to let him kind of lead the discussion on this one because it's a very interesting topic. And he's going to, I think, present some of the evidence on this. Is that right, Graham?
Yeah, so I first start out with mental health. It's a topic every pharmacist has some topic they like to, it's very near and dear to their heart. Mental health with such a stigma around it, I really have been drawn to it. One thing I would like to point out is number one, if you're going to be on something longer than a week, you should tell your primary care provider. And if you're treating something for a mood disorder, you're going to be on this longer than a week. Also, if you think that you're going to go ahead and try to treat a mental illness with probiotic, this is a discussion you need to bring up with your physician as well. because there are a lot of different products out there, prescription, non-prescription, including probiotic. But bring your prescriber in there just to let them know what you're thinking of trying. They may say, okay, we're going to give this a try for a little bit. And if I don't see improvement by a certain amount by a certain time, they may want to kind of make a change on that. So always be upfront with your primary care provider. As far as studies with depression, we had a study in 2020. There was 10 trials that were looked at, 700 patients with depression combined with anxiety. And as we know, as pharmacists, anxiety and depression kind of go hand in hand. The patients were, I believe in that study, 16 or older. None of the studies were older than 5 years old. And they found probiotics were actually better in treating depression symptoms than anxiety. The anxiety was the tough component to treat on these, but mood was improved. As well, the probiotics were better treating patients with anxiety and depression than anxiety alone. So depression seems to be the main focal point when we're treating mental illness. There are a lot of compounds or a lot of probiotics out there that would claim to treat anxiety. These are not things that you want to, again, go in on your own and ignore all medically what's out there for you. So bring your provider in there. And there's a lot of different proposed mechanisms as far as alleviating depression. One is the production of tryptophan. Now, tryptophan that's produced in the gut and perhaps maybe gets into the bloodstream isn't something that directly transfers into the brain. But Lindsay, the gut brain axis that you described there certainly uses tryptophan as one of the messengers in that pathway. So there was another review article in 22. It showed that the probiotic, and they looked at prebiotics in this study as well, that the probiotic had a little bit better effect than prebiotic treatment in reducing depression symptoms in major depressive disorder. So these people had to take these for a period of 4 to 9 months. And the two main strains they were looking at there were the lactobacillus and the bifidobacterium. So it's really kind of interesting how taking a live microbe can help with your mood. And it really speaks to the effect that the GI system has on our mood and on our overall sense of well-being. There's such a direct quote. And we looked at this with Dr. Demanios. He mentioned a lot of different ways that this could happen as far as, the gut-brain axis. And it's just such an important pathway that is just so open to the outside world when you think of how open our digestive system is and the insults that it takes on a daily basis and the effect that can have on your mood. It really helps to keep the health of your gut up as best you can to prevent that.
Excellent points, Graham. Any thoughts on that, Dragana?
I agree with everything that Graham said. And, it is something that the mood and effect has been an indication added to the clinical guide 5-6 years ago when we actually saw some of the first initial studies with specific probiotic strains in this population. And we also say in this indication, it is in along with the standard therapy. So not replacing your antidepressant or something, but as Graham said, make your prescriber, your primary care provider aware what you're doing. And both Canadian and US guide do have a set of products and actually different kinds of strains. There are some single strains and some combination strains that have evidence for improving mood and affect. So basically, a mild to moderate depression and stress-related issues as well. So I agree with Graham, yes.
Yeah, and it's important, I think, to remind people also that this is an evolving topic, right? This is where the science is really evolving on this. And yes, there's a lot of interest, but there's a lot that we just don't know, right? And so this is something that we all want to learn more about. And actually, in a few weeks, we do have a physician coming on the channel, and he is going to speak specifically about the gut-brain axis. So watch for that session coming up because it's going to be very informative. And again, there'll be a Q&A as well. And then also Graham has a full chapter just on this topic in the book. So those are really, really important points. And I want to get on to the next topic, unless one of you would like to say something.
Oh, let's keep going.
Okay, let's keep going. So probiotics can relieve everything from irritable bowel syndrome to high cholesterol. So I wanted to just go over a few quick slides from Dr. Damianos from last week before we just kind of open the conversation for this question. Because if you missed that presentation last week, it's worth going back because he really explains how IBS, which is irritable bowel syndrome, is quite complex, and it's not really, it has to be a multi-pronged approach and also a multidisciplinary approach to treatment. So it's not simple. So he talked a bit about the FODMAP diet. He talked about some of the strengths and also the weaknesses of that diet, or the challenges that people find with that diet. He also talked about the standard Mediterranean diet. And he did talk about how probiotics, how there may be evidence for probiotics and what that evidence is currently. And specifically, he spoke to how probiotics may help with specific symptoms of IBS. And so we know that IBS, there could be a constellation of symptoms. Sometimes it's more constipation related, more diarrhea related. And so these are his slides from that presentation. And so if you go back to our session from last week, you can see this full presentation where he presented this. And here he's showing IBS that was diarrhea predominant versus IBS that was constipation predominant, and what the evidence was in terms of probiotics for that. So I just wanted to go over that quickly, so you know that resource is available to you if you want to go a bit deeper on that. But Graham and Dragana, in terms of probiotics, are great for everything from IBS to cholesterol. I know you have some thoughts on cholesterol, Graham, but who would like to tackle that one first?
Let me start first, and then you take the cholesterol and specific things. I just want to say in this question, I agree and disagree, because I would like to say specific probiotics can relieve symptoms of IBS, and others can be used for cholesterol. So not all probiotics for all conditions. That's my take. Let's have Graham talk about cholesterol and probiotic strains.
Yeah, thanks, Dragan. I think it would be very difficult for me to add anything after last week's amazing presentation by Dr. Damianos. He just covered that. That could be a CE unit for professionals, the way he went over that. And you and I had gone over cholesterol in a previous one as well, Lindsay. The bile salts that are normally circulating the cholesterol back into the liver and back into the gut and making that circle for their whole life almost, that can be worked on by taking the bile salts and having them draw out of the body. So that takes cholesterol with them, and then you have to draw extra cholesterol in the liver from that. So that's just one mechanism that we think that we can reduce cholesterol with probiotics. And there's actually Health Canada approved probiotic for this, as shown on Dragana's site. So it's, when I first saw this as far as cholesterol goes, again, I look at this the same way I look at the mental health issue. Cholesterol is not something that we want to mess around with. And specifically, the main one we're looking at is LDL. We have ratios with HDL and LDL, and we have triglyceride levels and everything. It's the LDL that is going to do the damage for you. So that's the one that we need to look at. If you think that you're going to be able to keep everything down with probiotic, fair enough. But if you're not getting it down to a certain level, sometimes just increasing that amount isn't necessarily going to have a beneficial effect, and it may do more harm than good. So again, you're going to keep with your primary care provider on what you're doing, and they're going to keep checking your cholesterol. And if it works, perfect. You found a great way to treat your cholesterol. And we even have a mechanism as to how that would work. But if not, sometimes you have to add stuff to it. And that goes with most medical conditions.
Yeah, I agree. And a few things to add to that. As you mentioned, there are products listed in the guide. In Canada, we actually have a combination of few strains with specific name listed. And in US, there is actually more options, bigger market, more options. And the one of the best probiotics strains that is listed in the US and it's available in US was available in Canada. Unfortunately, discontinued. I'm not sure why. It's just the demand and the profit share. I guess if it's not there, then they just stop making it. But that particular strain was tested actually at McGill University in Montreal. So lots of Canadian studies done with that particular strain, and not only was lowering LDL, but was also lowering some of the inflammatory markers in cardiovascular disease. So great strain. So check what's available in US guide and also compare with the Canadian guide, and you'll see some of the options that we have. So, and again, let your doctor know what you're doing, because there might be, sometimes need to intervene with the other prescription medications in this particular for this particular indication with the LDL lowering.
Yeah, I think that really speaks to the work that we have to, I guess, for lack of a better word, convince prescribers and primary care providers what a probiotic can do. So, like, if something is not being sold on the market, it's because it's not getting recommended. And if it's just not getting recommended, it's not going to sell. So it's unfortunate that stuff like that does drop away from the market, but it really does speak to the need for education on something that does work.
Absolutely. Absolutely.
All right. So again, lots of questions coming in. So that's really nice. Thank you all for engaging, and thank you for the answers to that. I wanted to get to myth or fact number 5. Fermented foods are not the same as probiotics. Just a couple slides back, we'd be on myth number 5. So I actually covered this in session 2 with Graham. We talked about fermented foods. We talked about prebiotics and probiotics, and that's the same session where Graham addressed cholesterol. So if you want a more comprehensive answer, you can go to Graham's talk in session 2, where he talks about cholesterol, weight loss, and probiotics. And I remember someone had commented, I think it was maybe during that session, of course fermented foods are the same as probiotics. What are you talking about? But they're really not. And Julian, if you can bring up the definition of a probiotic for us, I know I have it there. But fermented foods, it's in one of our banners. Fermented foods may contain probiotics, but they don't necessarily meet the criteria of probiotics. So the definition of a probiotic, if we can go back to session 1, is live microorganisms that, when administered in adequate amounts, confer a health benefit on the host, which is what Dragana has been talking about here, as well as Graham. So when we speak about fermented foods, these are foods that have undergone some kind of a transformation, either via the application of heat or some other process that has altered the composition of the food product. And either one of you feel free to interrupt me at any point here. And they can be very beneficial. Fermented foods, sometimes people find that they're easier to digest. They can contain live microbes that are added later, but even if they contain live microbes like the ones that are seen here, it doesn't mean that they meet the criteria of being a probiotic, right? And the heat treatment that a lot of these commercial products go through in order to increase their shelf life can also reduce the quantity or concentration, or however you would like to, whatever terminology you would like to use, of the microbes that might already be present. So yes, fermented foods can have a lot of beneficial effects, but they don't necessarily meet the criteria to be called a probiotic. And I think, is there one more slide there, or is that it? Let me just see here. Yeah. So
I agree with you.
Go ahead, Dragana.
Yeah, I agree with you, Lindsay, 100%. So fermented foods are a great addition to our diet. And, one of the reasons for that is because they are a bit easier to digest, because they're already broken down by quite often different kinds of microbes or fungi or yeast. And they can be beneficial. We should not ignore them as a part of balanced diet. But if you're looking for live bacteria or probiotic that will get benefit for us, not necessarily will get enough of those or specific strains that will be beneficial for us, unless a product has a specific strain in specific amount added to this product, and then that dose has been tested in series of good design studies, and they are that specific kind of yogurts or probiotic fermented milk products with specific strain added listed in the guide. Only few of them. Or the oat milk or oat juice with specific probiotic added to it and becomes a probiotic, because on the label they have a first, last name, and nickname of that strain. That means Lactobacillus plantarum 299V. All the parts of the name are listed, and it tells you exactly how many colony forming units per serving of this particular yogurt or drink it has. That becomes a probiotic as a supplement. But again, there's nothing wrong with eating yogurt at any time, but it's not a probiotic. Some of the live cultures or bacteria in it might be still alive, may not, when you are by the time you're actually ingesting that yogurt or fermented product.
Graham, anything to add to that?
Yeah, I think the public rightly is quite confused about fermented products and how it relates to, prebiotic and the probiotic. Just because it's fermented doesn't even mean it's good for your health. I mean, you could drink as much wine and beer as you want. It doesn't mean you're going to be healthy. And those are, fermented products. We have fermented foods with live microbes. So we're talking about, the sauerkraut, kimchi, some kombuchas and things like that. But like Dragana says, as much as I love to argue, she's 100% right. It's the amount that's in it. Even if you had the exact same probiotic that was in something that is proven to work for a medical condition, if there are just trace amounts in the fermented food, now, don't get me wrong, fermented foods can be still healthy. You can't really refer to it as a probiotic. There are people that, try to stick as much as possible to fermented food, and they more than likely will have an overall better gut health as long as they're eating it in moderation. They're not getting a lot of extra sugar with it. But I think overall, sometimes it's better if you're looking for probiotic to get the exact dose that you are looking for. And in order to do that, you have to buy the supplement in order to get that.
And Graham, are you sure about wine and beer? I'm now disappointed. I'm just joking.
About being not healthy? Well,
Yeah.
I think basically it's fermented. I can tell you that. We'll agree on that.
I'm just joking. I'm a pharmacist. I'm also a menopause practitioner. I'm discouraging my patients to drink, but as I say, I was just joking. Go ahead,
Yeah.
Lindsay. We are getting too light and too irresponsible here. So go
No,
ahead.
that's great, Dragana. It's Saturday night. Why not, right? But actually, Graham does talk about alcohol and the microbiome in the book as well, and he does not speak well of it because there is some evidence that it can disrupt the microbiome, right, Graham?
Yeah, it's kind of interesting how that works. Actually, drinking alcohol can, in some cases, can increase the growth of the microbiome, but we're not sure if it's directly the alcohol creating more or if it's because of the irritant effect that it has on the GI lining that causes a different growth of microbiome. So we're always hunting, just like coffee, we're always hunting for either one of those beverages to extend our life by 1 or 2 days. But as far as alcohol goes with the microbiome, it's not typically friendly.
All right, we will leave it at that. So for the next myth, this was one of the most searched topics on Google, so that's why it's here. Fecal transplants can be an effective mega probiotic. There is so much misinformation out there about this. There is on TikTok and all kinds of places. There's all kinds of weird stuff going on. So I think, Graham, did you have some slides for this one, I think? Right? I think Julie.
Yeah, the fecal transplant thing is certainly ripe for shooting it down. I'm always for looking at evidence for something as far as improving your health. There are a lot of ways to get fecal transplant, and quite literally, a fecal transplant is what it sounds like. We're taking stool or stool product from one person, and we are essentially instilling it to the bowel of another person. And hopefully, what that does is it helps to to better the microbiome in the recipient. So you can get it by an oral capsule. A G tube allows you to do quite a volume of a transplant. There's enemas. There's colonoscopes. There's all kinds of different ways to have it instilled. There are actually a lot of clinics that are doing these kind of things. As far as having proof, the only evidence that I think I've really seen consistently where it's used for is for C. difficile infection. And particularly, I would say that would be left for C. difficile that does not respond to antibiotic or is chronic. You know, some people just kind of have it forever or repeatedly. So there are, I suppose it's been approved by Health Canada for the treatment of that condition only. But as far as having something on the market, even the US, the FDA has kind of done the same thing. Not a whole lot to go and buy off the shelf, and it's not something that would be done that way anyway. There are randomized controlled trials over the years for this that demonstrate that fecal transplant is has quite a potential in the treatment of C. diff associated diarrhea. There is still a lot more to learn about this, and if it ends up helping, terrific. Even if it only helps for that one specific condition, because the treatment for C. diff is so expensive compared to just what you could get for a probiotic, either something on the shelf that we know is in Dragana site or in a fecal transplant, if that's what works. What we're trying to do is we're trying to also not just help the health of the person, but to decrease costs on healthcare. And the cost of probiotic compared to the downstream effects in hospitalization and more expensive treatment, I think the risk benefit speaks quite favorably to probiotic. Now, again, getting back to fecal transplants, there is, if you're looking at claims on fecal transplants as far as health, I've seen a lot of them myself. Quite often, there's not a lot of evidence for a lot of it out there outside of C. diff, but we have a lot to learn on this whole topic of probiotic, and that's one of them. And we'll just have to see what the future brings on that.
Yeah, and if I may add also to that particular one, we asked a couple of years ago, decade ago, we have been very excited about the potential for the fecal transplant. What we also have learned is that you have to be careful who is the donor, and what is the healthy donor, and what is the normal microbiome that we are kind of harvesting that feces from, that carries some of the byproducts or still live bacteria that we can going to insert into the patient's gut that has already been devastated by the infection. So we have encountered complications and different kinds of side effects that are not pleasant or could be very serious. So the research has been kind of moving away from a direct donor or that kind of addressing the issue, but also looking at kind of universally healthy donor and maybe making this kind of a blend of bacteria from a good donor and replicating it. There are lots of research going at University of Guelph, McMaster, across Canada, US as well. And to the point that now there are pharma companies that are registering these kind of standardized fecal matter transplants into the medication that has a blend of so many, 180, 280 microbes from a healthy donor and making it a probiotic live therapy for the patients with C. difficile infection. So this is where I see future going, rather than doing it by the TikTok instructions how to collect your, friend or spouse, stool and blending it into something that you can actually do as enema. So definitely something to look for and leave to researchers and clinicians and centers and medical centers to actually find out the best way to do. Don't do it at home. No.
Yeah, and I've heard that as well in regards to the challenge of finding the right donor, right? Because there's so much diversity in the microbiome, and we do see that, the microbiome follows even the circadian rhythm. So if the donor has recently traveled, if the donor has recently, been ill with some kind of viral infection or something like that, right? So what are we really transplanting? Even if that donor was essentially healthy, right? What is the perfect donor for the individual? Someone mentioned in the comments here that generally it's the spouse. Do you have any thoughts on that, Dragana? Have you seen anything along those lines, or?
There was a documentary actually released recently. I think there was a patient with inflammatory bowel disease that was using the spousal stool, and this particular, this is testimonial case report, person improved. It doesn't mean that will work for everybody. As you say, our microbiome carries lots of messaging, lots of genes, lots of different things that we can then instill to somebody else what it means, what kind of messaging, what kind of a potentially superficial next infection we may be instilling to somebody's already damaged mucosal lining. So we have to be extremely careful with that. So yes, that's, we'll hear more. We are staying, curious about it, and we are looking for more evidence, but safety must be our paradigm. First, safety.
Yeah, absolutely. And when we speak about probiotics, we are speaking about bacteria, but we cannot forget that bacteria can also be pathogenic and it can cause a lot of problems, right? So definitely something that we're all interested in learning more about, but we'll leave it to the experts to do their research and come back with the results. So okay, I'm going to move right along because again, more questions still coming in, and they're all excellent. I want to get to them. So number 7. Probiotics can help to prevent diverticulitis. Graham, would you like to take that one?
Well, currently for diverticulitis, we modulate the gut bacteria with antibiotics. So there's usually 2 at a time that we give for diverticulitis. And the unfortunate part of that is that it's changing the bad bacteria, but it's also changing the good bacteria. So this, as being a gut issue, was on the radar for probiotics and how well it could help. And I think there was a few different slides we had for this one. I know the first one had to do with a 10-day, there's a probiotic supplement that was given for 10 days, and it showed like an 8.1% reduction in the grade of abdominal pain from day 1 compared to a 6.7 for placebo. So this is a placebo-controlled trial. These are the ones that we are basically looking for to tell us as much truth as possible. There's a C-reactive protein that was inflammation marker that was decreased as well in the first 3 days of treatment, and there was a 20-hour reduction in hospitalization period of patients supplemented with the probiotic, which is a lot. When you think of the cost of being in the hospital, even changing your stay in the hospital for a few hours translates to a lot of money to government. So it's a very cheap way to try to treat or supplement with diverticulitis current treatments. There was a second study, Lindsay, that we also had a slide for that decreased probiotics in a group 72 hours from hospital admission, and that on average seemed to really have a huge effect on the people that came in with pain. And the pain is the biggest part of diverticulitis. I think if you could treat that and then the infection would gradually go away, I think you'd have a big market there. On the whole, the findings show there that the strain that was used, the 4659 strain, could help patients with acute uncomplicated diverticulitis to manage that pain and reduce hospital time. And the inflammatory markers were also down, which really speaks to how these probiotics are working in the body. To reduce inflammatory markers shows you there is really a lot going on when it comes to giving a probiotic. And I think in our third reference and slide, it was more of a review. And it's just being aware that bacterial colonization of the diverticula is involved in the pathogenesis of acute diverticulitis. The rationale for the potential role of probiotics in the treatment of this disease becomes clearer when we're aware of that colonization and the dynamic that goes on. And so giving probiotics might be able to modify localized and persistent inflammation that happens even in between bouts of diverticulitis, because really the inflammation that can be there may not go away even in between bouts of that. And there seems to be some evidence that points to helping in reducing inflammation even when the infection is gone. And that's the only study that I really saw, although it was a review study, that mentioned looking after patients in between bouts of diverticulitis. And inflammation is one of the biggest drivers of disease. Any way you can keep inflammation down is a huge benefit, and kind of a no-brainer when you think of something happening in the gut and probiotics being helpful for, and hopefully a lot more will come out on that.
Thank you very much for sharing that, Graham. That's some excellent evidence there for us. Did you cover that in the book? I can't remember.
Yeah, so this came from the book. It was I covered as much as I could on GI issues when it came to probiotic, because it seemed like there was probably the most amount of evidence there for it, but it is covered in the book.
Yeah, and we also have seen those studies, and we have them in our docket waiting for the product to become available. So stay tuned.
Oh, that's
Good.
exciting. Thanks for sharing that, Dragana. And I want to emphasize that these sessions, again, are not sponsored by any probiotic companies, because if you're just tuning in, you might just think that we're pushing probiotics. We're not. We're trying to clarify for you what the evidence is for probiotics. And we'll also tell you when there's no evidence for probiotics. And so we have these experts here. We have Graham Mackenzie, we have Dragana, who is the author of the Clinical Guide to Probiotics. We are all pharmacists who operate from a standpoint of being evidence-based. And so if there isn't evidence for something, we're not going to recommend it, right? And we're trying to clarify the misinformation that's out there, but also the utility and the evidence that is out there for the possible use of probiotics. And so I say that in going into our 8th myth here, where we're going to cover this question. When it comes to probiotics, more is always better. So, when you look at a probiotic, and I have brought a couple probiotics from my cupboard, not sponsored here, but when you look, it looks like I stole these because they still have the tag on them. But when you look at the strains, you see this like 5 billion live cells, right? Or you see 3 million and you think, well, 5 billion is probably better than 3 million, right? And so what does a consumer do? What does a patient do with these numbers? Is more always better? Dragana, do you maybe want to start out?
So again, this is easy answer, no. However, let me explain why. It's not always more the merrier. When we look for probiotic and we like to get the effect from that probiotic, we have to know what has been shown to help. There have been some misinformation and kind of a misguidance saying anything that is less than 10 billion cannot work. That's not true. So strains will actually provide amazing benefit at a 500 million of these colony forming units per dose. They may save the newborn baby from necrotizing enterocolitis at a 500 million per dose. It can be great for colic for babies, the same low dose. But other combination of strains, they have shown benefit at 450 billion colony forming units, and they can help people with inflammatory bowel disease, ulcerative colitis, or prevent pouchitis in those patients. So some serious complications can be helped with the probiotic combination with 450 billion. So 500 million versus 450 billion, but different strains and different indications. So don't look at the number, look at, is there evidence for this strain? And when they use this strain in studies, what was the dose used to actually provide the benefit? Recently, we had a very popular Canadian milk product, looks like a yogurt, with a specific strain added. And that particular product had 10 billion colony forming units per small bottle. It was great to prevent colds and flus. It helps to prevent diarrhea with antibiotics and other things. the company recently changed the amount of colony-forming units per dose from 10 billion to 1 billion. It's not going to work. You cannot drink 10 of these bottles per day to get the benefit. So the product was delisted from the Canadian guide. So kind of these things can be very tricky, very tricky. So don't look for more colony-forming units, or what happens sometimes, oh, this product has 15 different strains, or this product has 25 different strains, must be better. Not always, because those strains might be competing with each other, not providing benefit, unless you see there has been a study showing benefit for this specific combination. Like Graham has a Maple Leafs jersey, Maple Leaf team. They play well together. They are a great team. If I join them, I don't think they'll play well. So that's why, not better, higher numbers are not always the better numbers. Graham, what do you have to add?
Yeah, that's maybe the Leafs are all on probiotics. I don't know, but it does speak though
I like the
to
hockey analogy, Dragana. Thank you.
yeah, good pick. Yeah,
We are
it
Canadians.
it does speak to the human nature of more is better when it comes to medicine, and we saw this with increase in hospital admissions with melatonin, and people just thought, well, if 1 or 3 isn't going to do it, then I'll take 15 milligram, and it's just not the way it works. It's the exact same way in the prescription world. We have a specific recommended dose for a certain condition, and probiotics are no different. To be honest, I think most of the ones that I see are in the billions range as far as CFUs. The millions range, there really aren't as many, but the ones that do work, and I think this speaks to scientific studies that need to be specific. When they say that it doesn't work, they should say the strain and the dose that they used didn't work for a given condition.
Yeah, and I also think that it's not necessarily the person's fault for being led astray, because when you see the marketing on the product, they know that that number attracts the consumer. 5 billion. I mean, this is so
Mhm.
impressive, right? How can you get that many in this capsule? Oh, this one's 10. So I think that it's not to make anyone feel bad, right? But if you go to, like, Dragana has made this guide, and you can see what the evidence is, right, for the strength, and also the duration of treatment, right? But if you have ever looked at those labels and been impressed, I mean, I think it's just like Graham was alluding to earlier, it's human nature to see
Absolutely.
that, and it's marketing. I mean, it's designed to do that.
Absolutely. And I want to also add something else. We keep saying about evidence, but evidence changes. As I say, we learn something new all the time. That's why even on our guide, we have, evidence up to date. So that's why the publication is valid for a year, and after a year, it's already obsolete. So because changes, and that's what we do. We look at what is the latest, what we are learning, and then we'll pass that knowledge on to you. So this is what this whole project with the clinical guide to probiotics, the books that Graham has been writing, and this you promoting all this knowledge with videos, it's updating. What is what we learned, and this is what we know up to now. We might be proven wrong next year, but let's see.
Yeah,
That's
and that's
true.
go ahead.
It's just like this is what we deal with medicine, and if you don't stay with science, then you really aren't really that scientific, because like Dragon says, every year things can change with a recommendation, because what we learn, it's just like a jigsaw puzzle. We get another piece in there and things become more clear, and it means sometimes we do have to make a different recommendation for a dose.
Excellent points. I want to get on to myth number 9. We're almost done. We're going to be taking your questions. Incredible questions that have come in. Keep those questions coming in. You'll be entered in our draw for a free copy of Gut Logic. Or fact number 9. Probiotics are always safe. What do you guys think in the comments? Are they safe? Dragana, impart some wisdom.
So Probiotics are not always safe. You have to be careful for whom you're using it. There are some populations that we have to be extremely careful. There have been lots of reports of the infections or sepsis with the specific strains. They are extremely rare, and in extremely sick population or administered inappropriately. So that's why, any critically ill patients in hospital, patient on central venous line or something like that, we have to be extremely careful if there are probiotics administered. Severely immunocompromised patients. However, at the same time, probiotics have been used, some specific strains, for those sick populations with great benefits. So it comes back to we cannot say probiotics are safe for everyone every time. Specific strains for specific conditions, even in sick populations, but we have to know what and how and when to administer for those patients.
And I think one group that sometimes is or always is underrepresented when it comes to medicine would be pregnant and lactating women. We just don't really round up pregnant and lactating women to do randomized placebo-controlled trials for obvious reasons. But we do know that as far as in pregnancy and in lactation, the amount of the probiotic that would be absorbed and even conferred either before birth or during lactation to the infant is so incredibly rare that it was deemed to be safe for both. And I think the risk of developing an infection, they estimated from lactobacillus probiotics, is less than 1 per million users. There's a lot more bad things that could happen than taking a probiotic. So it's funny how the information has evolved, because when I graduated 31 years ago from pharmacy, giving a probiotic to somebody with diverticulitis and giving it to a pregnant or lactating woman would be something you would kind of shy away from. And because the evidence has kind of evolved a little bit, we now know that that's changed, and it's certainly safe enough to give if you're pregnant or lactating.
Yeah, and if I just like to add to that, there have been studies, really great studies in pregnancy to prevent gestational diabetes. Actually, there are probiotic combinations that have fairly high level of evidence, along with the nutrition counseling and other lifestyle interventions, to minimize the risk of developing gestational or treating gestational diabetes in pregnancy. Also, there have been studies giving the specific probiotic strain to prevent or treat mastitis, which is a condition. This is inflamed breast tissue with lactating mothers, with breastfeeding mothers. So probiotics can be given to that population to minimize the risk. There's lots of research looking at providing probiotic strain specific kinds to pregnant mother in the last trimester if they have high history of atopic disease or allergies or eczema or asthma, to minimize the baby actually developing the same. So with great results. So lots of research going on in that population as well.
Yeah, it seemed like most of the studies that I looked at were they involved usually the last trimester, or certainly the last half of the pregnancy anyway. And it's reassuring to see those results.
Absolutely.
Thank you for sharing those insights, both of you. It's amazing that you can remember all of that there, Dragana. That was impressive. Um, Graham, you too. So onto our next myth here. Now, this is one that, as a pharmacist, I would say maybe, I don't know, 10 years ago or so, we would always think, so maybe it was longer ago because it was before we had the guide. We would always think that refrigerated probiotics were better because the reps would come around and we didn't really have any other place to find evidence. And it was special because these had to be in the fridge. So there must be something special in there. But I know that's not necessarily the case. And someone was commenting that these probiotics that I had from my cupboard were actually in the fridge. They're not. These don't need to be refrigerated. So are refrigerated probiotics always better? Why do they need to be refrigerated in the first place? Dragana, would you like to start out?
Sure. So with the storage directions, it really depends on a strain. Specific probiotic strains are maybe more fragile. They are not resilient to exposure to oxygen, temperature, or light. Then they have to be refrigerated, packaged specifically, so then they prolong their shelf life. So then they will actually be still viable live potentially when we ingest them as a patient or consumers. Other probiotic strains, or even some of those kind of yeast for based probiotics or spore based probiotics, are extremely resilient to all the environmental impact. So they can be stored at room temperature, still be viable, still provide benefit. Specific spore-based probiotics can even be exposed to heat. You can actually bake with them and they still will provide benefits after they're ingested. So it is, again, to do with the specificity of the strain. So that's why, stating that refrigerated are better does not really mean anything. It's just that specific strain will not survive long on the shelf or exposed to heat. As one kind of interesting example, we had a product in Canada and US, appeared probably 15 years ago. It was for kids and it was in a drops form and it was in a fridge. It was not stable at the room temperature. They figured out how to package those drops so then oxygen and air will not go back into the bottle. And this strain became resilient and could stay longer on the shelf. So no longer the same product needs to be refrigerated. So, it's just some simple change like that makes, protects the strain better. So the storage is to do with the strain resiliency, nothing else, not the efficacy of the strain.
Well said, Dragana. I know I was recently listening to a podcast that mentioned Akkermansia, and apparently that one cannot be subject to any oxygen. Even a molecule of oxygen will kill it when it's being produced. So, like all of these species of microbes, right? They all have these different conditions, right? That they have to be kept in. So that's a great point. Graham, any thoughts on this one?
Yeah, there's actually one brand of probiotic we sell that's blister packed, and the blister packs are there's no oxygen there; it's in nitrogen. And some probiotics just can't survive the freeze dry process in order to stay viable. I've actually had patients come in and their prescribers told them make sure that you get one that goes in the fridge because otherwise it's not going to work. And so you're always trying to battle misinformation like that. But typically, if you see it in the pharmacy and it's on the shelf, I think we can trust the pharmacy knowing that they're refrigerating what they should be.
All right, I think that covers that one. Let's get on to number 11. We just have 2 more to go, and then we're going to be into our viewer Q&A. So if you have questions and you want to be entered into our draw for a free copy of Graham's book, ask your questions or let us know where you're from in the comments. If you comment, you'll be entered into the draw. So myth number 11, in healthy people, probiotic supplements offer little benefit and can potentially do more harm than good. I know there are people out there who just take probiotics because they think, well, I think it's good for me, and I just felt like I should do it. So if a person is healthy and they're not necessarily taking a probiotic for a specific condition, is there really any benefit there? I think this is a really important one to tackle. Who would like to start with this one?
Graham, do you want to go first?
Okay, I'm just going to give a quick answer. If you're completely healthy, there really is no reason to take a probiotic. The only people that would be taking one that don't have an existing condition would be perhaps people that are trying to prevent diarrhea. Other than that, I have people that they feel fine. They come in, I hear it's a good idea to take a probiotic. Should I take it? And money costs money. I mean, you just have to take stuff when you need it. And probiotic to me is not something you would take if you don't need it.
I agree 100% with you, Graham. And it's, when you think about how do we define healthy? If somebody is really not having any digestive issues or no other risk factors, and health-wise it's great, making sure that you eat a balanced diet, that you actually eat lots of those prebiotics, good fiber, good polyphenols, good antioxidants in your diet. You have enough sleep, low stress. That will support your gut microbiome the best. But again, if you are traveling, for example, you might take probiotics that will minimize the risk of traveler's diarrhea. Or if you are going to the cold and flu season, maybe you would choose a probiotic that has benefit to minimize the risk of those common infectious diseases. So this will be all short-term interventions. So, but just taking it because everybody is taking it and because everybody on Instagram and TikTok are telling you to take it, don't do that. Save your money, invest your money in something else, go out for a walk, get some, good fiber, use your money wisely. There's really no need to take it just, because everybody's taking it. And second part of your question, it can potentially do more harm than good. Most of the time, it will not do any harm except to harm your wallet. And again, sometimes, if it's some not proven mixture of probiotics and you're taking it for no reason, it might cause some digestive issues, might cause some bloating, some gas, etc. So, but not really real harm. So that is a bit of misnomer and misconception based on one poorly designed study that was published and then talked about in Washington Post and headlines and stuff, but it was debunked since. So no, there's really no real harm, but there's no need to take it.
Thank you for that, Dragana. And I mean, even, you think about a publication like the Washington Post or, different sites that people can go on to find out the interpretations of some of these studies. And quite often they're not right, or the study gets retracted. And so, I mean, we have to be so careful these days, right? Because we're getting our information from so many different places. So that was a really good overview, I think, for that myth. Myth number 12. Can probiotics decrease the incidence? Number 12. We'll flip to that slide when possible. So, can probiotics decrease the incidence of colds, allergies, and eczema? Now, I mentioned earlier that we do have a physician coming on the channel in a few weeks who's going to specifically address the microbiome and the propensity to acquire different common infections, including some respiratory infections. And so that's going to be coming up in the next few weeks. But Graham, you also addressed eczema in the book. And so what is the evidence that we have for or against the use of probiotics, maybe for colds and even allergies? Because I know that you touched on that in the book as well.
Yeah, and I remember really looking into this in a lot of detail because one of the pharmacists that works for me, his kids really have a lot of problem with eczema, and we do have a Health Canada approved product for atopic dermatitis, I guess we'll call it, and so there is some help there. But when I was finished that chapter with eczema, I really realized that some uses of probiotic were much more proven than eczema. And interesting studies that came out. There was like a studies done on pregnant women that were taking probiotics, and it seemed to have some sort of a less of an effect on eczema in children as they grew older, which is remarkable when you think of it. I mean, that you can prevent in later years eczema in your child because you took it when you were pregnant. Currently, when you look at the Cochrane Review, they're a little bit iffy on this subject, but there again is something that we still have yet to learn, because we do have some one product at least that's Health Canada approved, and I think Dragana can speak probably a little bit better to on her guide, one with a little bit better evidence than most products out there, because I have seen products come through the store that were they would claim that they would help for eczema, and really you go looking for evidence there, and there was not a whole lot. So I don't mean to put a downer on this one. I can just say that my feeling on probiotics, this might be the one thing that we disagree on, Dragana, because we have to have something we disagree on. This cannot happen all night. I'm going to go with minimal help, if I could put it that way, with probiotic.
This is the second thing we disagree, like a wine, beer, and this. So with the eczema, this is very, very interesting topic, and we are seeing actually more and more evidence. And as you mentioned, different interventions in prevention and also in treatment of childhood eczema and atopic dermatitis. This is what we're talking about. Childhood eczema and atopic dermatitis, not adult one. Not much evidence for the adult eczema or dermatitis. But for those kind of early years when we have kids that develop the eczema and then maybe go to these allergies and asthma, like atopic march. So for those patients, there is actually more and more research, more and more products and evidence for specific probiotics or probiotic combinations. And yes, we have them listed in the guide, but we also, because it's kind of an interesting topic, sometimes you cannot say, this is for eczema, but only if mothers took it when they were pregnant. So we don't have that in the guide. But that's why we gather experts, and Dr. Damianos was one of them, and Mike Boyven and Dr. Nadine Nakla. And we actually developed the learning module on probiotics in childhood eczema and atopic dermatitis. That learning module is listed on a ProBio website. You can access it, and it's designed for healthcare professionals to kind of go over the connection between gut microbiota and in the babies. What are the influences and impacts of early feeding practices or the mode of delivery? And then, if you do intervention with probiotics, at what point and with what kind of probiotics? And we look at the studies and findings from those studies for this specific indications. And again, research is still ongoing. And you'll see also in this learning module, we talk about sometimes the studies were done with the very young babies, and sometimes studies were done with actually a little bit older infants, toddlers, and kids up to 14 with still good evidence. So not too many products, but again, really good evidence as well.
Well, with those names that you threw out there, I will just say that I would be stand corrected then, because those are giants in the field, as you are. So I hope you're right.
So again, we keep learning. So this is why we keep learning from each other. We keep exchanging and discussing these things. And every time I speak with you and Lindsay, I learn something new. So absolutely, this is, and I like to be also challenged sometimes by maybe, this is not right. I'll go back to my reading and say, no, let me see what I miss. That's why I work with the best, as I say, with any work on our learning modules or on a guide, I stand on shoulders of giants. It's not my work. I just coordinate those amazing brains to work. So
yeah, and this when I came up with this idea for the book, you two first and foremost came out. Lindsay's such an amazing educator, and you, when it comes to probiotics in Canada as a pharmacist, yours was really the only name that came to mind, and I think it just magnified the book so much more, having you both on board with this and your knowledge.
Thank you.
Well, thanks for including us, Graham. It was a fun project, right? And now we have this resource, right? And so hopefully it's sorry, it's right here. Hopefully it's helpful for not only healthcare professionals but also just for people to have as a guide, right? So that concludes our myths or facts, and we're still all friends and colleagues. We have not had any major disputes, but it does speak to the scientific consensus, right, and the ability to really question each other, and the need for that, right? And so and also the point that you guys brought up about how the evidence changes, right? Science evolves, and we have to evolve with the science, right? And so so that's really important, I think, to point out. So I'd like to get into the Q&A portion. We've got some really thoughtful questions that I know we get in the pharmacy sometimes, but I think that it's really important to address some of these, and some of these you have addressed in the book too, Graham. But just getting to some of these here, let's just see. So this one just came in, and I thought this was really interesting. So should probiotics be a prescription item, So we're sure we're getting what we really need. These are so many things to consider. So I thought that was a really thoughtful question. I've seen a few different things on different things becoming non-prescription. I know in the US, maybe, there's some items becoming non-prescription, but should these be prescription? Any thoughts on these?
If I can jump in first, Graham, and then you come in.
Yeah.
From perspective of easy access, yeah, we don't really need to make it a prescription, but I do agree with the person asking question. Maybe we would be more responsible recommending them if they were prescription. Saying that, I can tell you there are some prescription probiotics coming up. And what's actually happening, there are, for something in the US, a probiotic to be a prescription or to have official claim for something, they have to do huge and expensive study. And once this probiotic strain is approved, it becomes prescription and becomes probably 10 times more expensive than same strain available without prescription or over the counter. So I'm afraid that if we start moving towards prescription level or of evidence or prescription approach to some strains of probiotics, some proven strains of probiotics, we'll restrict the access because of the cost. So it is kind of a tricky question. Graham, I'm not sure what you have to say to that.
Yeah, I mean, there are a few hoops that you have to jump through. We've seen over our career many medications go over the counter, and I think they're looking as far as if someone's got a damaged liver, damaged kidney, is it safe enough to put out front? And for probiotics, the answer would be yes. If there's a lot of interactions involved, I suppose that would be another factor that keeps something behind the counter, and that's not really an issue with this one either. I think the one good thing, I suppose, if there was one or two that were prescription, is that it would become more credible with the prescribers. And then, if something was, too expensive on prescription, they could say, well, there are some others that are out front and there's some evidence for it. Talk to your pharmacist about it. So I think really ease of access, having stuff over the counter, I'm a huge fan of. And I think the way we have it now is the way it should be.
Yeah, and I hope that question didn't come from someone that was maybe overwhelmed by the amount of information that we were providing. But it really is more complicated, right, than just a marketing ploy or something like that. And so,
Yeah.
again, you do have the AE Probio reference, and you can ask your pharmacist, and most pharmacists, I would guess by now, would be aware of that reference, right? And if not, you can always remind them, and they can look it up and help you find a solution, right, for whatever it is that you're looking for. So this question also, PPIs come up all the time, and for good reason. One of the most prescribed medications in the world, proton pump inhibitors used for acid reflux, also ulcers, that kind of thing, peptic ulcers. So does the use of PPIs cause a depletion of healthy gut bacteria, and should a probiotic be taken in that case? And I know that I think that you talked about PPIs in the book, and you also talked about PPIs in session 2, I believe, Graham.
Yeah, so the PPI, for people that are listening in here, they're very effective acid reducing agents in the stomach, and this is our gatekeeper to what is going through into the small intestine. So when you reduce acid very effectively, which is what these medications do, it opens up your body to a lot of organisms that typically wouldn't be in there. So there's a question, does it cause small intestine bacterial overgrowth, and should we take probiotic for that? Certainly it might be easier for a probiotic dose to get through into the gut if you're on one of these medications, because nothing's killing it. I think it's a legitimate question. Even pneumonia is easier to get when you're on these medications because of the bacteria that's allowed to be in your body. So as far as depletion of healthy gut bacteria, it certainly gets overcrowded by bad bacteria. And I know people that are on these medications indefinitely. When they first came out, it was like a 6-week prescription. Then there's no as needed dose of this at all. A lot of people on these drugs just don't seem to have any stomach issues, so it's not a given, but they definitely are not going to have the same composition in their gut as somebody that is not on them.
Yeah, that's a great answer. Anything to add there, Dragana?
I can just say that there have been and there is still ongoing research to see if we can use probiotics to minimize the side effects of PPIs, with kind of a interesting but not compelling evidence to support any specific probiotic strains. We also have some strains that have been proven effective if we are using PPIs along with antibiotics to eradicate H. pylori from a stomach, and they are listed in the guide. So again, there's still more research, but also as Graham said, if we change the pH level of the stomach and we keep changing it and keeping it, higher, and then allowing some of the bacteria from small intestine to come up, and maybe bacteria from outside to stay where they should not be, we are changing the composition of our complete gut microbiota, and then we can end up with more complications and problems. Adding probiotics to the mix, we still don't have evidence that it will be beneficial just for that. So stay tuned. There's research going on.
Yeah, and like I had said, the proton pump inhibitors are so widely prescribed. And often people are on them long term and sometimes for good reason. But what I've often seen is that people are just chronically prescribed them. And after a certain period, it's like they don't even remember why they're taking this. And the physician doesn't even really remember. Maybe they're seeing a different physician or something. So it's a good opportunity to even talk to your pharmacist about, hey, like, first of all, don't make any changes to your medication without talking to your pharmacist or your healthcare provider, but sit down with your pharmacist or whoever your healthcare provider is. And if it's your pharmacist, ask them for a medication review. Right. This is something that
Mhm.
pharmacists do. And we see this a lot where there's medications that have just been prescribed chronically long term. And sometimes these aren't necessarily needed, or even there's a possibility of a dosage adjustment or something. So don't do this on your own. But it is something that I've covered proton pump inhibitors on the channel. You can look for my videos on them. And it's a class of medications. They're amazingly effective, like Graham was saying, to help reduce stomach acid. And they do really helped people a lot. But there are some caveats sometimes, just as a result of the healthcare systems that we are part of, right?
That's correct.
Yeah.
There are definitely one of the topics of the deprescribing initiatives in Canada and choosing wisely in Canada. So, with efforts to actually use them appropriately. So deprescribe them or stop using them if they're not needed, but you cannot do this on your own. You have to speak with a pharmacist or physician. Yes.
Yeah, if you do it
Yeah,
on
when you
your
have
own, you can actually get a rebound effect. And so that's why we're really cautioning you. It's not that we don't think you're capable, it's that there's a way to do this where it's safe and effective, but it does need to be accompanied by a healthcare professional. Sorry, go ahead, Graham.
I was just going to say, you know that there's a problem when there's a deprescribing protocol out there for us to use and for prescribers to use to get off of something. Really, it's not something that can be easy to get off of, and it can be something just as simple as somebody went in the hospital for a procedure, and just to prevent a stress ulcer, they were put on a medication like this, and then when they left the hospital, it was continued, and they're on it for years after that. So maybe it was only intended for a month to begin with. So that's why these med reviews are always important. You just revisit why you're on something, and you revisit even the dose that you're on. Maybe you don't need the same dose that you had 20 years ago when you started on it.
Yeah, exactly. That's an excellent point. And pharmacists love to do these medication reviews because usually we're able to help you with things that you didn't really know that maybe had solutions, right? And that
Mm.
example of people going, being in the hospital and being prescribed something and then it's just chronically prescribed. I've seen that so many
Yeah.
times, right? So it's good to just follow up. And these medication reviews in Canada are free. So I mean, it's not even a cost to the patient. Next question here, moving right along. Is there a best time of day to take probiotics? I believe not all providers are versed on probiotics. Where do I go to read and educate myself? Great question. Thank you, Marlene, for that question. Dragana, any thoughts on this one?
Best time of day? There's really no better time of day for any probiotics. They will not affect your, circadian rhythm. So you can take them morning, afternoon, evening. with or without food, most of them. So there's really no specific time. One of the things that we maybe have not mentioned that, we don't really have evidence on timing of probiotics with antibiotics. And empirically, we are still saying take them 2 hours apart if you're taking antibiotics. But this might be corrected as more research is going on, showing that some probiotics can actually help antibiotics work better. So for now, that's the only suggestions that we tell you, because based on previous experience, not on some specific hardcore studies, but no other timing as far as I know. Graham, do you have any other suggestions?
Yeah, that's really interesting when you say that about taking it with antibiotics, that they can actually maybe help them work better. I think our standard thing as pharmacists is we say separate them by a couple of hours because, if you have an infection, that jumps to the front of the line. So we do not want to disrupt the antibiotic at all. And so there's a thought that if I take a probiotic with my antibiotic, is it going to get gobbled up by the antibiotic and effectively decrease your dose? Well, you're right. We don't really know that. Our standard recommendation is just to separate them for now, but we'll see what happens with more information when it comes out.
Yeah, and in terms of resources, where can I go and educate myself? So I know we've mentioned the AE ProBio site, right? So aeprobio.com is great. The International Scientific Association for Prebiotics and Probiotics as well is excellent. Do either of you have any other recommendations for resources? Don't go to social media.
That's correct. I'll let Graham talk, but the APROBIO stands for Alliance for Education on Probiotics. So it's not site where you get buy probiotics. You get free education on probiotics, and there are different kinds of resources. Access to both clinical guides, Canadian and US, is there, but also additional information, webinars, things you can read about are all on that. So this is kind of maybe a good starting point. ISAP, they have great information. They will not recommend any specific brand names, but they'll give you lots of good information, patient-oriented. They have great infographics as well. And again, I don't know really more about any kind of easy access, good information. Graham, do you have any other resources that you like to recommend aside from the book?
I would say, yeah, I would say 100% of my recommendations are to your site. Really, it's so easy for people just to look at, not just a prescriber, but the patient as well. It's free. They're not selling anything on that site. It's just the perfect, all the boxes are checked off. These are the types of sites I'm looking to send people. And if I can send them there first without them Googling their condition and trying to find something that's automatically going to be an advertisement, then that would be the way to go. And, it almost seems like we're promoting the site almost to make money, but it's free. And it's just such a no-brainer to use. It's for anybody to use. So that would be the one that I recommend anyway.
All right. And I'm going to go to, I think, what will be our last question. If you have any more questions, please, you can leave them in the comments. We've got just a couple minutes left here in this session. It's been a great session. We've covered a lot of ground here. So Kim asks, regarding IBS, are there gluten-free and dairy-free options for probiotics? I thought that this would be an interesting one to cover because so many people are trying to try all these different diets, right? Or need to maybe be gluten-free or dairy-free. Is this covered on the site? I'm not sure.
So anything that, in the listing in the guide, online or in the print or on the website, there will be small symbols beside the name of the probiotic, and it will be symbol if something is gluten-free or if it needs to be refrigerated. Unfortunately, at this point, we do not have the symbol indicating what is dairy-free. So that you have to find at the website of the company or on the package as well, because most of them will actually tell you if it's dairy-based or dairy traces or dairy-free. But starting point is if you're looking for something for IBS, do the search on the website maybe and look at all the products listed for IBS. pick those that are gluten-free first, and then maybe just go by one and see which one is actually dairy-free. So there are still some probiotic products that do have traces of dairy. So maybe eventually we will add this to the guide, but it's good kind of point. If there's lots of questions about it, we might adjust that and list that indication as well.
Mm-hmm.
Yeah, I think this is one of the reasons fermented food is so popular when it comes to probiotic. I mean, I know the
Oh, I think we lost Graham for a moment there.
Yeah.
But that's okay. We're just nearing the end of our session here, but just I did want to sneak in this last question too, Dragana. Are there? Oh, Graham's back. Graham, we lost you there for a moment.
Sorry, yeah. I just wanted to say that there are companies, a couple of companies out there that are gluten and dairy free, and they make probiotics as well. So, and I think this is one of the reasons the fermented food was so popular. It just people knew that they could avoid any dairy issues. And Dragana, one question that comes up sometimes with the lactobacillus probiotics, if there's any issue with dairy with those, and my belief is that there's not.
No, there's not really. Even though, with the lactobacillus, the whole, species has been renamed now. So now they'll have I don't even cannot pronounce these names because some come from plants, some produce slime, some come from milk. So there's really no traces of dairy in those strains. But
Right.
some others might have a bit of a dairy product as a base when they grow those strains in a factory. So then those traces can carry in the product. So look at the label of the product. Don't look at it. Strains will not tell you whether it has a dairy or not.
Okay. Good point.
Excellent. And that question does come up quite a bit. So thank you, Graham, for mentioning that. So I just want to pull up this last comment here. Kim has asked, are there learning sites or webinars encouraging family physicians to educate and encourage in prescribing to patients? Before we answer that, I want to let you know, Kim, we are going to give you this resource. You are the winner of our Gut Logic copy today. So if you can email me at friendlypharmacy5@gmail.com, this is a resource we will provide you with. And so at least you will be well educated in the area of gut health and probiotics. But Graham and Dragana, in terms of resources, I mean, Dragana travels the world talking about probiotics. So she's an excellent resource and she does give webinars and talks. So I'm sure you could reach out to her. But as far as stuff that the public can easily access, I know AE ProBio has webinars and they have research reviews on the site. All of this is free. So definitely check that out. But any other ones? I know we covered resources a little bit already, but anything else that comes to mind?
So if you're looking for something for healthcare professionals, why don't you point them to this series of live events that we are doing right now? Because Lindsay has gathered so many amazing experts, Dr. Damianos, Graham, everybody, and everything is evidence-based, and I think presented in a way that was easy to understand. So that would be a great resource for the healthcare professionals. As you mentioned on a ProBio website, we have had webinars with Dr. Damianos, Dr. Armstrong from McMaster, Dr. Eamon Quigley from US, from Texas, I believe, Dr. Charabati, a leading expert in GI and liver health. So we had lots of different experts talking about probiotics and these conditions, and those webinars accessible online. So for you to share with your healthcare professionals to educate themselves. So absolutely. And ISAP has great resources for healthcare professionals as well.
Graham,
Yeah, I think
anything
as
to add?
professionals, it gets CME points. Yeah, like professionals can find their CME points wherever they need to. Like we have our Canadian Healthcare Network, and we can go looking for the topics we want. Physicians, same thing. If you want to find a CE on something, then your own association should be able to help you, and so this is the professional side of it, and I think that's where it needs to start. Your prescriber and your pharmacist, that if they have this knowledge under their belt, then I think more people will be using probiotics for at least specific conditions that they're looking for.
All right. Well, that covers all the myths and facts. And I think the questions for today, we were able to get to almost all of them. I want to let people know, thank you, Dragana and Graham, for joining us for this. And for, again, we were mentioning we've never really met in person, right? But this book project and now the channel project here really brought us together. And it's been fun to do this with both of you. So these sessions are ongoing for the next, I think, 4 weeks, and we do have more guest speakers coming. So tune in to these upcoming sessions. And next week, we are not going to be live on Saturday. We are going to be live on Wednesday at 10 a.m. And we have a special guest joining us. And so Dr. Paul Wishmeyer from Duke University will be presenting and taking your questions on gut health. And he is going to be speaking about the fundamentals of gut health and also the microbiome and common infections, including things like C. difficile and stuff like that. So I have not stuff like that, things like that. And so I have heard Dr. Wishmeyer talk. He is incredibly engaging. I know this session is going to be incredibly informative. And I think, Graham, you'll be joining us for that session as well. So again, that's Wednesday, this Wednesday at 10 a.m. And that live link will be up in the next couple of days. So you can click notify me and you'll be notified of that. So thank you so much, everyone, for joining us. Again, we've given out a free copy of Graham's book, and we featured a lot of different topics from the book. So we hope you will join us again next week. And Dragana will be back. She's going to speak about probiotics. A lot more information coming up for you soon. So thank you all for joining us. Take care and stay healthy, everyone.
Thanks.
Bye-bye.
See you
Thank
guys.
you. Thank you.